Kenneth, thanks for joining us. Can you tell us more about what's happening with foster care homes and what these changes mean?
Well, in Ontario, on May 8th, the Ontario government amended the regulations around Child Welfare Act to allow foster homes to increase in size, so from 4 to 5 kids. When I say foster homes, I mean parental foster homes, the kind of mom and dad foster homes that you might see. But the thing is, there are foster care companies in Ontario that also use these homes, or this type of model, as well as group home settings are much larger. So what's happened is they made these homes grow in size, because it's my thinking that these homes right now are in such dire straits that the foster care system in Ontario is likely so squeezed because of the pandemic that they're running out of space. So the ones they do have that haven't shut down because of it, they're increasing them. It's a pretty extraordinary move, but they're doing so also with less oversight. Like they're also allowing inspections to happen over the phone. You know, I know a little bit about these homes. I've worked on this for a few years now, and I haven't really dug in publicly and shown what I know about these homes. But on a good day, often they struggle. In a pandemic where you can't leave, and with no oversight of a telephone call or a video chat, maybe, if you're so inclined, I don't know what you're going to catch. And I think critics are saying this is a really, really bad move. And it also could include group homes for inspections. Like, group homes are much bigger. Like in Ontario, they can get up to 12 kids. But they can also be inspected, it appears, over the phone. And things known as enhanced foster homes, which are basically group homes but with less restrictions but more kids. So it's really thrown things into disarray, because a lot of people didn't know about it. I only found out about it recently. It's been over a month, and I cover this stuff. Like, it's been pretty quiet.
So homes going to have more kids, less oversight. Any other changes that were made?
Absolutely. The ministry has suggested, advised, or asked agencies, foster care agencies, child welfare agencies, to refrain from getting unnecessary police background checks, only if they're deemed essential. So a child welfare worker is deemed essential, but they're saying don't do it. So they're specifically saying don't do it for board members. If you need to get a board member needs to get a background check for vulnerable children, or I work with vulnerable children, maybe let that slide for now. Well, a board member oversees an agency or a foster care company. They are the ones who decide, well, you know what, we need to make changes. So if they can't do their job, then right now that says there's a lot less oversight even from internally. But there's more to this too. They also are requiring less documentation of workers that are hired, like immunization records and health records that you generally need to have to show you're not going to bring us measles into the home, are you, or a virus of some sort. Just tell us if you can remember if you've had those shots. That's what they're saying right now. Right. So as you can imagine, people on the outside who didn't know about this, like I'm talking about prominent lawyers, caregivers that I know who are on some of these, that they're good caregivers, they didn't even know about this. They didn't even know they're allowed to do this. So I think it's been happening in certain areas where they found it to be, things might be collapsing. That's the term people are using behind the scenes. Like, what I put in the story is only a little bit of what I'm hearing. And I'm hearing that there's a lot of concern that they're in dire straits and they need to expand whatever they have. The only problem is they're doing it with less oversight.
Kenneth, your work on children dying in care has earned some journalism awards in recent months. How do you see these moves by the Ford government relating to the broader child welfare crisis?
I think it's going to potentially lead to deaths, because these are the homes the kids die in that I've written about, these larger homes. The more kids you have, the less supervision, the more issues that have been found, have been documented. Every single death that I've written about or uncovered, except maybe one, which is a different story, were in larger foster homes, enhanced foster homes, and group homes. So all these homes that were these First Nations children have been dying in now have less oversight.
Kenneth, appreciate your reporting on this and joining us to talk about it.
Right on. Thank you.